The Pericardium Channel is a yin-yang pair channel of the Sanjiao channel. It's also the hand channel of Jueyin. The pericardium primary channel starts in the center of the chest. It connects with the pericardium, then goes down through the diaphragm to the middle jaw and the lower jaw. There is a branch from the inside of the chest that emerges near PC1. It goes down along the anteromedial aspect of the arm and passes PC3. It goes between the tendons of the palmaris longus and flexor carpi radialis muscles and ends at PC9. Another branch comes out at PC8 and ends at the radial aspect of the ring finger. The pericardium luo-connecting channel starts at PC6. It goes up the arm and connects with the heart. The pericardium divergent channel separates from the primary channel at the upper arm and goes to the chest to connect with the upper, middle, and lower jaw. There is a branch that goes to the throat and emerges behind the ear, joining with the Sanjiao channel. The pericardium sinew channel starts at the middle finger. It joins the lung sinew channel and binds at the medial side of the elbow. It goes up the anteromedial aspect of the upper arm and binds inferior to the axilla. It disperses in the chest and binds at the diaphragm. Here are the key points. The primary channel originates in the center of the chest. The primary channel and divergent channel traverse the upper, middle, and lower burner. The divergent channel crosses the throat and goes to behind the ear. The primary channel connects with pericardium. The luo-connecting channel connects with heart. Now let's look at signs and symptoms. The pericardium primary channel manifests stiff neck, contraction of elbow or hand, pain along the course of the channel. The pericardium luo-connecting channel has excess and deficiency syndrome. For excess, there is pain in the heart region and mental restlessness. For deficiency, there is stiffness of head. Signs and symptoms of the pericardium sinew channel are pain, stiffness, and sprain of the palms, inner aspect of arm, elbow, axilla. Pain in the heart region. Now let's go over some major acupuncture points on this channel. PC3, 7, 8, and 9 clear heat from nutritive and blood level, treating bleeding disorders or skin disorders. PC3 can clear heat from the qi level, so bleeding this point can treat high fever, agitation, and thirst. Also, it harmonizes the stomach and intestines, treating vomiting and diarrhea due to summer heat. PC7 is the major point for emotional disorders of both deficiency and excess nature. PC8 is similar to PC7, but it is better at clearing the liver fire transmitting to the heart. PC9 is used for reviving consciousness as well as for the tongue disorders. PC4 invigorates blood and dispels stasis. When there is acute pain in the chest that radiates to the back or arm due to blood stasis, this point can be used. PC6 is another major point that treats chest pain. These 2 points calm the spirit and have beneficial effects on mental and emotional disorders. PC6 can also regulate the functions of the spleen and stomach in the middle jaw and the liver in the lower jaw. Like many other points of the pericardium channel, these 2 points can clear the heat, but PC4 can cool blood and stop bleeding. PC5 is a major point that transforms phlegm, often used in the phlegm disorders, such as swelling of the axilla, plum stone qi, mania, and epilepsy. It is also indicated for halting speech and loss of voice. If you want to learn more about acupuncture prescriptions according to patterns, please check our blog The link is in the description. In the next video, we will learn about the Sanjiao channel of Han Xiaoyang.